Good day, everyone. Thank you so much once again for coming out. This is day 7 of our Black Health History Month. And looking at the of the month of February and the year, that's much the month, but the year, I do understand that we actually are celebrating the arts, the Black arts during this Black History Month 2024. However, it's just as equally as important, especially with everything that's going on in this world right now, the craziness of the healthcare system, our community struggling, not understanding how to get resources, where they go to get those resources, just simply feeling like they're just left alone. It's important, and it was important to us as a nonprofit organization to actually ask some of the heavy hitters in the healthcare field, hey guys, can you please come and help us? Because we're trying to uplift our community and uplift those who are, negatively impacted. We're all negatively impacted, but the under-resourced and the vulnerable and the disabled communities are really negatively impacted. And so with this being Black History Month, what I was like was, okay, let me ask. And they generously, including our speaker for this evening, Ms. Deirdre Kindred, generously said, Sandra, why? Of course. So with all that love during this, Valentine's Day month and getting it all together and everything going as it should be going, we're going to continue what we're on. Once again, today is all about health literacy and how to understand your medical treatment plan. But we're going to keep this going for the entire month of February. When we're done at the entire month of February, if you are someone that would like to have the slides, please reach out to me. Send me a message through Facebook or through LinkedIn. Say, hey, Sandra, can I get day whatever? Or did you guys cover this? Can I see this? Not only will I be sending you the link, be able to send you the link of any show that you may have missed, but you really want to see, but I'll also be able to, send you the information in reference to the speaker, because guess what? The speaker wants to continue to speak and wants to continue to collaborate with whoever it is that is interested in collaborating with them. So this isn't all about, just this one-time thing. And, this is about carrying it forth. This is about doing the work. And I said from day one, our ancestors are probably up in heaven or wherever else their bodies are laying, and they're probably partying, because they're probably like, that's right, you go get them. You do what you need to do in order to make this all happen. So with that being said, I am going to go ahead and I am going to introduce our speaker for this evening. Please note, before I do go further though, I do want to say this. I have been asked numerous times, and I love you guys for asking me this. Sandra, can we get the speaker's information like a day or two ahead of time? And my answer is no. I don't like to say no, but my answer is no. And this is why. We have, this is 7. We got 23 more speakers, and each speaker deserves the respect of having their information highlighted first, and then when their day comes, highlighting the other ones. So if you're interested in knowing, of course, I will tell you if you call me or send me a message and say, hey, Sandra, what do you have coming up? I will go ahead and tell you so that you can make your decisions ahead of time, whether or not it's something you want to be at or whether you want to ask me for the link to the show. That can happen. But there's a reason why I do not put, everybody's information together and everybody's information on LinkedIn or on Facebook ahead of time. The speakers, if you're following the speakers know they've been given posts, they finalized their posts. There's a lot of work that has went on behind the scenes so that they're ready, I'm ready, they're ready, and we get the patients ready for the information that's going to go forth. So please, if there's anything that I can do to help you to understand what's next, or when is such and such coming up, please ask me. If you're following one of the speakers, please ask them. They will be made aware of who's going on during weeks. Tomorrow starts week 2. Once again, it's going to be full of speakers who are actually they're going to bring their A+ game, because it's for us, y'all. It is for us. So they are going to bring their A+ game. And I keep looking down because I'm trying to make sure that StreamYard has actually started on LinkedIn as well. But not to hold the game up any longer or hold the evening up any longer, I'm going to go ahead and start. Once again, Miss Deirdre Kindred. Now check this out, y'all. I didn't just go get y'all no Jody Blow. I didn't get y'all no Susie Q. No, none of that. None of it, right? I'm bringing to you the best of the best. Miss Deirdre Kindred is an RN. She's a BSN. She has her LNC. She is also a CCM. And check this out, y'all. She's a BCPA. Not only is she a BCPA, she's a Black BCPA. I'm going to let her fill you in on just how important that is, that you know what a BCPA is, who are Black BCPAs, and just a whole gamut. She's going to explain all of her initials to you, hopefully. She's going to explain all to you, as well as give you the information that you need to know so that you can become an educated and empowered and engaged patient. She is a Texas Women's University nursing graduate of 2001. She brings over 15 years of expertise in cardiovascular intensive care and a rich background as a former affordable assisted living and services owner. She has 5+ years in home health nursing, 3+ years in home care infusion. And today she proudly owns, y'all, she's a CEO, she's the boss. She proudly owns and leads Your Healthcare Nurse Advocates, PLLC. Deirdre's inspiring journey is marked by her dedication to educating individuals and families, empowering them to make informed choices. And so with that, all of that being said, I am going to go ahead and turn the mic over to Deirdre and let her explain herself and her passion for what she does and her passion for why she is here this evening.
Wow, Sandra, thank you so much. I'm so excited. My voice is just full of enthusiasm. So I want to commend you for what you are doing for our communities. It is a wonderful, wonderful feeling. And I am with you that Black history should be every single day. We are incorporated in our journey. We are history. Okay. Just because they give us a month does not mean we should not be celebrated every day. So thank you, Sandra, for what you are doing for our communities. Well, hi, everyone. My name is Deirdre Kindred. And as Sandra eloquently put it, I am a nurse of 25 years in the industry. I'm a registered nurse. That's what the RN is for. BSN is Bachelor in Science in Nursing. The LNC is Legal Nurse Consulting. So I helped attorneys look at medical records to see if it was meritorious or not. I'm also a faith community nurse. That's the FCN. I am also a certified case manager. And above all else, I'm a board certified patient advocate. I feel like this is my purpose from God above, and I am extremely passionate about educating individuals and families to have the right information. Sometimes in healthcare, the healthcare professionals don't really have the time to sit with you and explain how your care or treatment plan affects you personally. And I'm on a mission to make sure that that doesn't happen with any of my clients or the people that I come across. So I'm humbly honored to be your presenter today. I'm super excited about this presentation because health literacy is key for us all. So why did I start this business? So I have two whys. Professional why is when I worked in the cardiovascular intensive care unit, I did not have the time to sit with you and explain about your medications, what were your next steps. Working as a home health nurse, I did not have the time to explain about what you needed to ask at the doctor's visit. So, my whole goal is to make sure you're educated. My second and most important why is my mom. So, at the age of 52, my mother started battling. It looked like Parkinson's, and it also looked like MS. Well, at the age of 52, the doctors were saying that she was too young for Parkinson's and she was too old for MS. So it was an 18-month journey back and forth, testing. And in the meantime, she was still suffering from the symptoms. So let me say, symptoms of Parkinson's and symptoms of MS can look the same, but both disease processes are treated totally different. So after we finally got through that process, in addition, so she had MS, she was diagnosed with Parkinson's, she ended up getting dementia related to Parkinson's, she had asthma, where she had to go get allergy injections, especially during seasonal changes, and she had colon cancer. So that was a minimum of five specialists and a primary care physician that we as a family had to help her juggle and navigate. Now, had I not been a nurse, wow. And you have to have a life, and you have to take care of the kids, and you have to take care of the husband, and you have to take care of yourself. So you're last on the totem pole. So I am very passionate about helping individuals and families be able to have a plan. How are you going to navigate the complex healthcare system for your loved one? Patient advocacy is so important to me. Patient advocacy means that your advocate joins your team to help provide the education and expert guidance toward what you need. And I'm quite sure you already know that there are several different types of advocates. No advocate fits all genres of what you may need. But as far as your healthcare nurse advocates, our specialty is chronic illness. So we are helping people learn how to navigate and get everything in order while they're navigating their chronic illness journey, because it's a day-to-day change, a day-to-day challenge. I'm going to give you a quick disclaimer. We are not doctors, lawyers, or financial advisors. We are independent professionals. We are not affiliated with any sponsors or advertisers. We are experienced nurses that are exercising within our scope of practice. So that's my legal nursing coming out right there. So just to kind of give you that. So session objectives for today, I want you to walk away, number one, with an understanding of the difficulties associated with maintaining your medical records. Big problem. I want to increase your knowledge of the strategies to effectively overcome these challenges. I want to help you learn the benefits associated with utilizing a tool specifically designed to help you have access and manage in an aging population. Explore the difficulties involved in locating reliable resources. In my world here in Fort Worth, Texas, Dallas, Texas, we do a lot of networking with other healthcare professionals. But my goal is to find as many resources that I can help bring to my families and individuals that I serve. And then we can have a little question and answer session if time permits. So, health literacy. Our topic today is, do you really understand your medical treatment plan? So health literacy addresses one of the most important things, because when you're sitting in front of your doctor, or you're sitting in front of in the ER, or you're sitting wherever you are, you need to really understand the complex changes that can occur. How are you going to get over hurdles that are preventing you from getting access to care? How are you going to really reduce your hospitalization? And oh my goodness, there's also patient compliance. That's a dirty word in the healthcare advocacy arena, but it is a word, because we want to make sure that you understand everything that pertains to you as an individual to be able to remain, quote unquote, compliant or understanding your treatment plan. I really feel like if you understand your treatment plan and how it affects you and how you're going to implement whatever it is they want you to do that, then you'll have better outcomes. According to the US Census Bureau, there are at least the last of the baby boomers were born in 1964. By 2029, all the baby boomers will be 65 years or older. If you think we're overwhelmed right now with the healthcare system, we ain't even ready. So, with that being said, it is very, very important for healthcare advocates to be available to you guys to help you navigate this complex system. So, what are some of the problems that are experienced by individuals, families, and providers? Number one is coordination of care. If you have more than one physician, coordination of care can be complex. They may not have the same goals because these physicians, they're so overwhelmingly busy, they don't have the time to talk to one another. So we have to help them out. We have to earn our seat at the table because it's all about you. Communication gaps. As I just said, these physicians are overwhelmed. They don't have time to talk to one another. And then what about when you go into the hospital, your primary care doesn't know you've been in the hospital, or your GI doctor doesn't know you've been in the hospital. So the communication gaps are huge all throughout healthcare, whether it be home health, ER visits to your regular doctors. They just don't have that time to decrease those communication gaps. Not understanding your labs and medications, that's huge. I feel like as a nurse of 25 years, medications and labs are the foundation of healthcare, period. If you don't understand the why behind why you're taking your medication and how they affect your lab values and what those lab values mean, you're lost, right? So it's pertinent that you are able to find a tool or a system of how you're going to learn about your labs and your medications. Collaborating with your healthcare team. So many people are intimidated by healthcare providers and they are scared to mention something in a collaborative way. I always say it's not what you say, it's how you say it. I used to hate that phrase, but it's really, really true. So to get the physicians and the healthcare team to get over that bias, because number one, let's go ahead and talk about it. Sometimes there's an automatic bias because of your skin color, your language, your gender, or whatever. Sometimes there's a big bias without even being said or stated, but you can just feel it. Lack of resources. Like I was saying earlier, I do a lot of networking, so I know resources in my particular area for home health care or home care. There's a difference. Visiting physicians, visiting physical therapists, because some people, let's face it, you just can't get out. And that's the fact of the matter, right? And then finally, lack of work life balance. We're always striving for work life balance, all of us. It's always a roller coaster ride on work life balance. And at Your Healthcare Nurse Advocates, we help you to achieve some form of work life balance. So let's talk coordination of care. When I'm thinking of coordination of care, I'm thinking about you got 3 or more doctors, you got your doctor's appointments, you got your procedures. If they order home health, which is a doctor ordered plan, or home care, which is private pay caregivers that will sit with your loved one or run errands or do things like that. A medical calendar versus your social calendar. Because let's face it, you're a human being and you deserve to have a social calendar as well as a medical calendar. And sometimes being able to speak up for your coordination of care, that also involves your social calendar. Lots of times physicians forget that. right? They're saying, go to this procedure, go to this, do that. But what about your socialization? That goes back into work-life balance. When we talk about communication gaps, huge. Patient portals. Mm, 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 mm. Whew. I have a love-hate relationship with patient portals. They're great if you know how to navigate them. They're great if you know what to pull off. They're great, again, if you don't forget your password. But at the same token, all patient portals are not created equal. Changing physicians. What happens when comes around to October-ish? Everybody knows we're doing Medicare. What if you change your physician? That former physician does not have a responsibility to send your new physician any paperwork. We got that responsibility as consumers of healthcare. There we go. Changing insurance. What happens when your new insurance plan doesn't accept your old physician? What happens to that paperwork, that all that work you've done with your former physician in that transition? Again, lack of time for the physician to communicate. They actually end up reading your medical records maybe about 3 to 5 minutes before they enter the room. I'm not placing blame on these physicians, but what I am placing blame on is insurance. I'm placing blame on even us as consumers of healthcare. We got to help these physicians out in order to help ourselves. Okay. Changes in medications. What happens when you go to your pulmonologist and he stops a medication and starts a new one, but then your kidney doctor needs to know that, your PCP needs to know that, your neurologist needs to know that. Any change in any medication, all your doctors need to know that. And let alone understanding the why. I think the why is the most important question in healthcare. Why do I need to do that? Why do I not want to do it? Why should I do it? So that is extremely important. Let's talk about some of these doctor's visits. So, collaboration during your doctor's visit. So, in our culture, sometimes it's expected I'm going to the doctor and he or she is going to tell me what I need to do. Not my clients. We're going to the doctor and we're going to have our questions already written out about what we want to talk about, because our time is just as precious as the doctor's time is. Like I just said, having notes ready prior to the visit. Lots of times I have a pre-doctor's visit with my clients. What is our biggest problem that we're going to focus on today at this doctor's visit? How am I going to take the notes at this doctor's visit? What are your goals and plans on how you're going to implement whatever the doctor just said? Because lots of times we go to the doctor, they say things and we're like, we zone out. We only hear 20% of the stuff that the doctor is talking. So it is so imperative to have a family member, a care partner, a buddy, a neighbor that you trust, or a patient advocate be with you at these doctor's visits. Who is going to be on your medical team? You can't do it alone. I talk about a doctor's visit like you're going to shop for a new car or a new apartment. You take a buddy with you, their eyes, they're going to see something totally different than what you've seen. The same thing with a doctor's visit. If you take someone with you to the doctor's visit, they're going to hear something that you didn't hear. That's why it's so important after that doctor's visit to talk with your care partner, your family member, your patient advocate, whoever went to that doctor's visit with you, to be able to understand and take in and be able to implement what they want you to do. If you want to do it, if it makes sense to you, you'll do it. If it's your goal, you'll do it. Being able to hear your goals, to being able to, for the doctor to understand your goals, I guarantee you, if you have it written down and you're sitting in that doctor's visit, they're going to respect you. Understanding your labs and medications and how they go together. So that's another thing that is so important with health literacy. As I said before, we have a post plan of care visit. So lots of times after a doctor's visit, especially if they prescribed a new medication, number one is so many steps involved when they prescribe a new medication because that doctor who prescribed that medication needs to know if this new medication interacts with your existing medications. So, who is helping you do that? Your pharmacist is one person that can help you do that. You know, talking about, they just prescribed me this new medicine. Does it interact with any of my other medicines? And that's when you can ask your pharmacist to run you a medication reconciliation. Or you can ask your nurse advocate to run a medication reconciliation. Post visit plan of care. Who's going to do what? That involves your medical team. If your medical team, I call it building a medical village. It could be anyone who went to the doctor with you, your son, your daughter, your cousin, your aunt, your care partner. Who's going to pick up the medications? Who's going to call and schedule the next visit? Who's going to take you to the next visit? Do you have transportation to get to the next visit? All this stuff goes into plan. Again, I talk about collaborating with other doctors on your medical team. So, true story, I had a client, they went into the hospital and they was a new client and she said, "Oh, my doctor didn't know I went into the hospital." No, ma'am, he does not. These doctors have hundreds of patients. They don't have the time to say, "Oh, you know what? I think Miss Johnson went into the hospital this month and I'm going to go check their medical records." No, it doesn't work like that. So it's our responsibility as consumers of healthcare to do those follow ups. There we go again, follow ups and implementation of a care plan. Care plans are subject to change at any moment. Life happens while we're making plans. So if you go into the hospital, get somebody to help you notify all your other physicians of what was done in that hospital, or call somebody who understands you and your medical plan already to make sure that the hospital didn't mess up your medications. Now, that's another presentation. That's another presentation altogether because it is so imperative that you follow up with all your physicians after a hospital stay. Solution. My. We got all these problems, right? How do we all help? And I put all of us in here because it includes not only patient advocates, doctors, nurses, CNAs, whoever, home health, but it also includes us. Effective communication assistance. I like to think of this as I'm taking notes all the time if I'm at my doctor's visit with my clients, or if they go without me, I have them make sure that they're taking notes because the notes that they're taking help them to retain some of the information, but also the doctor's notating things. So we put that all together. Providing reputable resources. There's so many wonderful resources that are probably available in your communities, but we have not because we ask not. So we have to find out, hey, can I get a home health order because I can't go drive to an outpatient therapy? Or what if I have a special needs child that needs 24/7 supervision and the doctor wants me to go to outpatient therapy? Can you, doctor, order home health to have physical therapy come to me? So many resources. There are companies that will come, well, here in Fort Worth, Dallas, we have dentists that will come to your home and clean your teeth. We have physical therapist companies that will come to your home and do your therapy. And of course, you got home health companies, home care companies, speech therapy, occupational therapy. It's a plethora of resources, but you don't know what you don't know until you start asking those questions. Introducing effective and easy to use tools. So I go back to the patient portals. You don't want to get on no patient portal if you're short of breath, you're in pain, the internet is circling, you just downright don't understand it and you're sick, those patient portals are a tool to build on to the new tool I'm introducing tonight. Assistance with building your medical village. So everybody's medical village is different for them. So your medical village can be different from Miss Johnson's or Curtis Jackson's or whoever's medical village. I think of it like this. Your medical village can consist of you, your doctors, your friends that are involved in your medical care, your family that's involved in your medical care, your pharmacist, especially, whoever is involved in your medical care. Lots of patient advocates. I've been kind of watching Miss Sandra from afar, been a little busy, but lots of patient advocates offer all kinds of educational opportunities. So there is nothing wrong with investing in yourself. So I commend you tonight and the rest of this month and forever for investing in yourself and learning about these educational opportunities that a lot of these advocates are offering. And most of all, we need to promote client patient engagement. And we do that by investing in ourselves. So I think a medical binder is your empowerment tool. Now, there are lots of techie items out here, but what I'm finding for many clients that are over 65 in the baby boomer generation, lots of them are very savvy, but lots of them are not. What about those that don't have the internet? What about those who have difficulty navigating the internet? So we help teach people how to build a medical binder. Why build a medical binder? Oh my goodness. It helps to simplify and organize for all its complex issues. When you have more than 3 physicians, I go back to that. What if they're not all on the same patient portal? They really aren't talking to each other then. So it can be very complex. I was telling someone the other day, the more physicians that you have that have an IST behind their name, meaning cardiologists, gastroenterologists, endocrinologists, nephrologists, neurologists, it gets more and more and more complex. Coordinating multiple perspectives. I kid you not. I have a client that went to the cardiologist. They said one thing. They went to the neurologist. They said the opposite. So being able to say, wait a minute, this doctor said this doctor said that. Y'all need to come together and explain to me how we can come to a consensus to talk about this so I can understand it. Because one doctor tells you go left, the other one tells you go right. What are you going to do? You're just going to stand there. So we have to make sure that they understand that we need to understand our plan of cares. Internet independence. So again, I say internet is a wonderful, wonderful tool. I know a lot of savvy people, no matter what their age, that are very internet savvy. But what about those who are not? We got to include everybody. So if you are fearful of the internet, you're not going to go on the patient portal. If you get on the patient portal after you remember your password, then what do you get off of there? What are you getting off the patient portal? And don't forget what happens if you change doctors. So now you got a whole new patient portal. We talked about the inclusivity of the non-internet users, and that's okay. We don't need to chastise those people for not wanting to learn how to do to navigate the internet. That's okay. But we have to come up with a tool, which we have, that will help people be able to navigate efficiently and effectively. And once again, when you're short of breath and you're in pain and you just don't feel well, you don't want to climb out of your bed. Go and try to remember your password and get on the patient portal and find out what you need to look at on the patient portal. And then sometimes you don't even understand it because it's in doctor speak. What's in it for me or my patients when building a medical binder? So we always have to talk about what's in it for me, right? Increasing your understanding of your medical journey. When you can say You can look at your medical binder. You can say, oh, mama has a cardiologist, a pulmonologist, a renal doctor, an endocrinologist. Mama's pretty sick and she needs some help navigating all that. It's an easy and accessible tool to have at your fingertips. We teach people what to pull off the patient portal and put in their medical binder so they can understand their trends, their labs, because that's so important. One of my pet peeves right here is I do not like it when you go to the doctor and the doctor says to you, your labs look good. What does that mean? Am I doing something right? Or am I doing something wrong? Or do I need to improve on something? What is it that I'm doing to make my labs look good? Let's have that discussion because what usually happens in healthcare, you go to the doctor, your labs look good, 6, 7, 8 months down the line. Oh, we need you to see a neurologist or a cardiologist or a nephrologist. Well, we could have discussed this back when my labs looked good. What did I need to continue doing? So that's my other pet peeve. This medical binder can help make your life easier and less stressful. When you can just pull your last mammogram, your last colonoscopy, your last results of whatever your testing was, it kind of keeps you up to date too. Because for a lot of my clients, I can say, oh, she had her colonoscopy this year. This was the results. So we need to schedule it for XYZ date. Or she had her mammogram last August. So I know ahead of time we need to get you another mammogram this August. It just helps keep that in order. And then when you have the results of the mammogram or the colonoscopy or your labs, it helps you be able to award yourself for doing something good or hop on if you're doing something bad to correct it, if you so choose. This basically is the end of my presentation. I want to say that healthcare is so complex, time consuming, and ever changing. So, at your healthcare nurse advocates, we do offer a free 30-minute phone consultation. We have in person and online educational workshops for families and organizations geared around building a medical binder. Your medical binder, as I say, is your empowerment tool. We have educational workshops on medications and how to manage those medications. We have educational workshops on how to review your labs and understanding the meaning behind those labs. We help you organize and manage your medical binder. And we have trainings on collaborative efforts on how to build your medical village. My name is Deidre Kindred. I'm an independent nurse, advocate, educator, and navigator, and I help change lives. Thank you so much.
And Deirdre, before you go, I'm not seeing any comments or any questions, but as we know, this video will be viewed a couple of hundred times, right? And people will have questions. So one of my questions is this. Well, actually, I do want to put a FYI out there.
Okay.
And this is my FYI. Patient portals, there are a lot of hospitals that are now charging patients to use their portals. So
Oh
when you
my.
go to the hospital, or you go, especially your hospitals, when you go to your hospital, or if your doctor is affiliated with the hospital, make sure that you are asking them if you have to pay for the use of that. But what that means basically in reference to tonight's video is this. You need a medical binder. You need to have a medical binder. You need to have the access that day one. We had Renee on and she was talking about her in-cloud service. I've actually written a patient a health planner and journal. All three of them do similar things, but Deirdre's medical binder actually gets a little bit more deeper into collecting the x-ray information and collecting, what your labs say and being able to be real. Being able to make sure you have the most up-to-date information. And then as you're looking at it, once you get it and you don't understand it, well, guess what? You come back to LinkedIn, or you reach out to me, you reach out to Deirdre, you reach out to any number of these excellent presenters that are presenting information to you today, and you say, hey, I need help, so that they can understand how they can help you themselves. And perhaps we might not be able to help you, but guess what? We built a village, so we know how to get you the help that you need. So please be mindful of that. You need to have your information with you, especially at the rate the hospitals are closing. What happens if you went to hospital BCQ and you find out BCQ is closing? Well, your medical records have to stay on file for a certain length of time, but then once that length of time is gone, they can destroy you. So what do you do when BCQ closes and you need your medical records and you don't have them? And you weren't proactive in getting, making sure that you had your medical records? What happens then? I mean, all of you that are listening to this video at whatever point in time you're listening to it, you're blessed, and you're blessed in this sense. You now have access to people that can help you figure it out. So we've got to stop, as much as I've said this from day one, and I'll continue to say it, we've got to stop sitting back and saying, well, this is this person's fault, that person's fault, the other person's fault.
Right.
Absolutely, positively, no one is coming to save us. So you have to be mindful. You have to share the information that you're learning this week. Hey, I heard that information. You have access to the links. I have no problem sharing the links with you. If you want to review something, if you want to call one of the presenters and say, hey, we would love for you to speak. I can't promise you that they won't actually ask you for a fee to speak. They have the right to ask you for a fee to speak, right? Because they're doing a job. But you work that out with them. You don't just not sit there and not do anything. You have resources. You need to understand. We need to stop saying, hey, I didn't know. I didn't know. I mean, I didn't know is a good excuse for someone that doesn't want their life. But you only have one life, just one life.
And one body.
Right. You don't do what you're supposed to be doing with that life, it's going away. You ain't going to be able to get it back. It ain't coming back. So what do you do at that point in time when, you done did nothing and your life is at nothing? I mean, you have story after story that we come across where people, are really, really sick and they're like, oh, I wish I would have did this. And I wish I would have did. Wishing is not going to help your situation get any better. And I don't know about any of you that are listening to this video, whenever you're listening to it, but I'm kind of tired of losing African Americans. I'm kind of tired of looking in our community and we don't see who we used to see. And when we find out, it's like they passed away when they was in their 20s or 30s because they didn't proactively take care of their life. So you can no longer say after this month, you can no longer say, I didn't know, because everything is being covered, everything. And you can't even say that if you're not of an African-American culture, because while we're focusing in on the African-American culture, this impacts everybody, not just the African-American community. It impacts everybody, but it's special to us during this month that we address those things that are occurring in our community. Why? Because we love them. And that's why we do it. So back off of my soapbox, and I have to ask you a question, Ms. Deirdre. You mentioned a couple of words that people may not be familiar with.
Okay.
One of those words is medical reconciliation. I know what it means, but can you explain to those who may be watching either tonight or later on, what exactly is medical reconciliation?
Absolutely. So a medical reconciliation is something that can be done by your pharmacist or your nurse or your doctor. So what it is they put all your medications into a system. That way they can see if there's any interactions, because all medicines don't get along, meaning that it's almost like you're making a pot of soup and you got your recipe. You add something else, a different medication. It may stop another medication from working. It may enhance another medication, or it may just be bad for all of them. So, any new medicines that you have added to your existing medicines, you need to ask for a doctor to check for interactions or contradictions, if that makes more sense.
No, that makes perfect sense. I would actually like to encourage those of you that are on medication to have a look at the medication list as well as this. You may have medication on there that you no longer take.
Oh,
Maybe they
yes,
took you off of it for whatever reason. Maybe
yes.
you were allergic to it or it didn't work well with you. That medicine is not just because the doctor takes you off of it, it doesn't disappear off of your chart or
Oh,
out
Sandra,
of
that
your
is so important
right.
because true story. My mother was sitting at a in an ER, and the doctor said, "Oh, we're going to prescribe XYZ," and I was like, "Nope, she's allergic to that." So your medications also include any over the counter, any supplements, any herbals that you may be adding to your regimen, because there's so many advertisements on television saying that, oh, this is the latest and the greatest medication. Ask your doctor about this. But also, I say, ask your doctor, does it interact with any of your existing medications? That's so important. So important. And then there's side effects versus allergic reactions. So that's something that we go over in our Making Sense of My Medications class, because they have to list everything under the sun for every medication that could ever happen because of the research studies, right? It may or may not happen to you, but it has to be put out there. So a medication reconciliation is so important with any new or even your existing medications. If you've been on certain medications for years, even having your pharmacist just kind of run, because you never know what those medications are doing, good or bad. You want to know that.
Deirdre, I'm not sure what happened, but we just didn't hear that last part that you were saying. So if you could repeat it.
Oh, no problem. Can you hear me now? Like
Yeah.
AT&T? Okay, so I was saying that even if you are taking some medications right now, it's still a great idea to have your pharmacist run a medication reconciliation for you, or just check for interactions and on your existing medications. I like to tell people at least run a new medication interaction checker at least every 6 months, if you don't have, even if you don't have any changes.
You want to weigh it again.
Oh, well, basically, I was saying that just ask your pharmacist to run a interaction checker on your medications, whether you've been taking them for years or you just got some new ones added.
And I'm so glad you brought that up. This is what happened. I was on some medication. I went to my doctor. My doctor, it was in was in a I had two doctors. One's in a really good neighborhood and one's in a not so good neighborhood. So I went to the doctor, and the doctor in the not so good neighborhood, well, in the good neighborhood, that particular doctor, she had a pharmacist come in and speak to me while I was at my
Mhm.
visit.
Awesome.
And I said to her, why don't y'all have this at the clinic, the other office, which was in
Mm.
Africa? Of course, it was in the majority African American community. Why am I
Mm.
coming over here and you are bringing you're having a pharmacist come in and talk to me about the medications I'm on, looking at everything. I mean, it was a thorough medication reconciliation done at the end of that visit. And I'm
Wow.
like, as long as I was going to the other doctor, why was this
Mhm.
never done over there? So that goes
Right.
to show you that we are getting, and if we don't know and we don't ask, we won't know. right? And they'll continue to
Right.
look over us. And there was,
Right.
of course, the excuse was, well, we don't know because everybody should be doing this. Well, y'all
No.
can send out a memo to everybody. And of course, once again, they had the wrong patient because I knew they wasn't going to do it. So I wrote the letter to the CFO at the hospital and the CEO at the hospital, and I demanded in the nurse case, the executive nurse manager at that particular medical group, and I asked them, why are y'all doing this? Of course, it came back that they didn't know and they would put out a memo. Now, whether or not they
Mhm.
put one out or not, it just showed me that there is substandard care going on
Yeah.
between these two. And this is a very well-known hospital in Chicago is affiliated with a very well-known hospital in Chicago. But it's just,
Mhm.
it happens all the time. Our
Yeah.
people aren't told what resources they
Right.
have. We don't get the best care. And it takes someone like me to call them out, but it shouldn't take someone like me that's trained in doing this. If patients stop sitting still and stop
Right. Right.
allowing any kind of whatever to happen at the doctor's office, it won't happen. Or happen at the
Right.
hospital, it won't happen. I'll tell you a few reasons why it won't happen. If you report it, they can get fined. If you
Mm.
report it, they can get fined. Hospitals and doctors both work under Medicare's STAR quality system. Report it, report it, report it. If they don't do what they're supposed to be doing and what they're getting paid to be doing, they lose that money. They
Right.
lose the doctors when they sign contracts with the medical group, with the insurance companies, they sign a contract that they're going to deliver top notch, pretty much top notch care. If they're
Yeah.
getting reported and finding out through the insurance company that they're not doing what they're supposed to be doing, when it comes down, because I've seen that happen, and when it
Mhm.
comes down to contract time, they lose their contract. Why? Because the patient experience isn't there. The patient
Yeah.
experience is substandard. But if we as African Americans continue to sit still and see wrong and know wrong and don't report it, we come on, people, we can't keep blaming
Yeah.
everybody when it's on us. It's on us to open up our mouths. Our mouths are the best tool we have and start
And I
speaking
want to
some of
say
this.
something too here, Sandra. What to me was so important, coming from the legal nurse background, documentation is key. So we have to teach ourselves how to write things down and ask the right questions and document that. So important. So I had one client, she has autism, and she said when she goes to the doctors, they talk at her and not to her. So when she built her medical binder, she took in her labs, she took in her medications, she was able to have a conversation with her doctors. It changed. So being able to say, I went into my doctor this morning at 8:05, and I'm talking, it's a lot of work, but you're worth it. We are worth the work. And that's why it's so important, especially if you have a complaint against a physician or whoever, and you got a timeline that's been documented. Ooh, documentation is key,
It is.
but we
And we need
also
to
have to educate ourselves.
It is. And I tell as many people as I possibly can that all the time. You can say what you
Mhm.
want to say, but if you don't write it down and make it clear, it didn't happen. It didn't
Right.
happen. It didn't happen. That's why as much as I possibly can, I write everything down. Who I
Yeah.
talked to, the time of
Yeah.
day I talked to them,
Right.
what they told me, I take all of it down. But what I do want to call out is this. You just said that client that you had autism. She was
Mhm.
able to speak up. So there's no reason why those of us that don't have a thing wrong with us are going into that doctor's office and accepting that substandard care that so
Right.
many of us get. We have to stop. At some point in time, we got to get off the yellow school bus, I call it.
Yes,
And we
ma'am.
got to we have to take ownership of what
Mhm.
actually is going on with our lives. Once again, we only get one time down this path this journey called life. We only get it one time. Once it's gone, it's gone. So let's
Yes.
do all we can to make sure that we're taking care of ourselves. Let's do all we can to make sure that we know, or at least you do know now. I mean, you have access to me on Facebook, LinkedIn, social media. You have access to Deirdre. You're going to have access to so many other people in our community that look like us, talk like us, know like us, that we're getting that substandard care, that there should be absolutely no reason why you continue to get substandard care, or you continue to take second best, there's no reason, and there won't be no reason come March 1st, 2024, where you should be sitting at home or wherever you sitting at complaining about the health care that you're getting when you have access to changing it all. That's what this is all about. This is changing it all. And educate, as the 3 missions for CHOM's MEDI-HELPZ Foundation. Patient education. Why? Because there are too many patients, especially in the communities, the vulnerable, under-resourced, disabled communities, that are not educated, and no one is bothering to educate them. Educating a patient leads to patient engagement. Engaged patient and an educated patient, that's the doctors. The doctors love that. They love when they get a patient to come in well prepared. They want to be able to help you. They're tied to a contract that says that they can only spend 10 minutes with you. So if you put them fully prepared, they could take that 10 minutes and give you the type of care that you need. They could take that 10 minutes and look at things, and if they're not able to understand it or respond to you, they're able to pass it to their office manager and say, hey, call them back because they had this, that, and the other, because they see you care. But if you don't care, I mean, really, at the end of the day, you don't care about yourself. Why should somebody else, right?
Yes.
And then the other part of our mission, in addition to the education, in addition to that engagement, is that empowerment. An educated patient, which I said this last year, and I wasn't able to do it because of some personal issues, but there's a patient uprising. And that uprising patient is going to show up at whatever medical site they got to go to. They're going to be educated, empowered, and engaged. Don't have to be in any certain order, but those 3 factors are going to be key with the patients that they're seeing now, because especially those patients in the African American community, especially in me and Deirdre and the other 27 people that's finna come in front of you, especially if we have anything to do with it, they gonna be sick of us. But that's okay. Let them get sick of us, because we're walking on the backs of our ancestors. We're walking on their shoulders, and for such a long time, the care that they received, no more. Stop.
No more.
Bus stops here. This is where the bus stops. So that being said, Deirdre, what I do want to do before we close out for the evening is I want to ask you if you have any parting words that you would like to leave with us.
Wow. First of all, again, thank you, because what you're doing is so powerful. Education and knowledge is power. And again, I want to iterate, it's not what you say, it's how you say it. And if you're in front of your physician or your medical professional and you are asking questions that pertain to you as an individual, they're going to start respecting you. They see you writing things down and having a plan and discussing a plan. And remember, you are an individual. Don't let anybody put you in a box.
And that is actually true. Nobody, we are all, and you know what? And no 2 patients are the same. There's something different about every last one of us. But the one similarity that we have in common is the fact that we're all humans, and we deserve to be treated with humans with the utmost of respect and the utmost of care. Once again, it's not about accessing care. We want to access the best of care. Even those of us that, and I know this, like everybody is not going to go to the doctor. Everybody is not going to be, looking for the best health care. They just want to go to the doctor if they go. I get it. I get it. But we need
Mhm.
to know that there are options and resources out there that are not being told to us. We need to know that there are options and resources out there that we need to be taking advantage of and that we do need to know about. And
Right.
so that's really, really important. Before closing out for this evening, I do want to say that day 8 of the Black Health History segment will be tomorrow at 6 p.m. It will be an audio tomorrow at 6 p.m. And the subject for tomorrow is clinical research from the patient side, as well as journaling. So we're hearing not some, we are hearing a lot about clinical trials, and we're hearing from the companies about clinical trials. Well, guess what? We're bringing a patient to you. So those of you that are considering,
Mhm.
participate in clinical research, want to know just a little bit more about what happens and how it all works and is it worth it? All of that will be brought to you tomorrow by Coach Patricia Pearson. She is right now
Awesome.
in a clinical, she right now participating in a clinical trial, and the story that she has to share and the love that she's going to share with you and with all the clinical research, both from both sides, the clinicians and the patient side, is going to be told tomorrow. So if you have no plans, please come out to, not so much come out, but please turn on your video, whether it's your phone, your computer, wherever, your tablet, whatever you have, turn it on and listen in, because it's a conversation that you truly do not, it's going to, just like the other 23 more, well, 22 more that we got to go, and just like the ones that we've had already, it's a conversation you don't want to miss. But if you do miss it and you want to hear it, just let me know and I will send you the link so that you can watch it in your time. Thank you so much, everyone, and continue to enjoy your day no matter where you are. Thank you. And thank you,
Mhm.
Deirdre.
Thank you, Sandra.